Good morning, everyone. Thank you for joining us this morning to engage in this conversation and the first in our series of deeper dives into some of the data that we started exploring at the December 11th coalition meeting. We collected questions during our data walk and to help guide some of these deeper dives into those topics so that we're able to answer some of those and just have more conversation around it. So today's presentation, we're going to focus on the research that Chelsea Prax has done on an educator's role in child neglect reporting and how schools can be part of both child protection and family support. Um, so in FY25, more than 90,000 reports were filed with DCF, and 72% included an allegation of neglect, and nearly half of those were screened out. We know that schools are among one of the largest sources of mandated reports. In Massachusetts, are actually the second largest, but mostly everywhere else, they're the top reporters. But that reality makes educators an essential partners in thinking about how concerns are identified and how families are connected to help. So our goal is not to discourage reporting when a child is unsafe. Protecting children is a non-negotiable, but we want to explore how schools can respond to concerns in ways that strengthen families whenever possible. So today, Chelsea will review the data, share learnings, and talk about some practical pathways that support educators in making those thoughtful decisions. So thank you all for being here and being part of this work. And with that, I'll hand it over to you, Chelsea.
Thank you. Good morning, everybody. I am fighting a cough, and so you will see me downing some tea and putting in cough drops and trying to, as much as possible, make it through this whole presentation. I have a bunch of slides for you. Let's see. Here we go. And I'm going to share with you, if I can, come on, buttons. Here we go. I want to focus on data from the publication that we pulled from in December. You all got a tiny piece and you gave me an incredible array of questions. So today I want to get a little bit further into those numbers, into what we learned from the survey. And as much as possible, I have pulled from the questions. They were transcribed by the Children's Trust team, and I'm going to show some of them back to you and then answer them directly. I'm also going to show some citations. How did I learn what I know? If it wasn't just from my own research, and try to give you a little bit of background as I walk through child welfare systems transformation from my perch. I work at AFT. It is a national union with a footprint in education, healthcare, and public services. And I focus on children's health and well-being. I used to be a teacher. It was a long time ago. I have a master's in public health, and my job now is to work on public health in schools. That includes a whole bunch of things. But in 2020, I really started to look at how educators are connected to child protective services. In particular, there was a lot of coverage in like May and June of 2020. So you remember it. We were, some of us, we were masking. We were leaving our groceries in the garage before we brought them inside. We didn't know how to get COVID, but we knew we didn't want it. And one of the things that was happening as many schools, almost all schools, went to virtual learning was that educators' reports to child protective services were dropping. So this was popping up in the news. I reached out to a bunch of partner organizations and sort of said, like, do y'all have a position on this? Do you know what's happening here? Should this be something we worry about, or like what we do? And there were two orgs that really came back to me, one of which was a long conversation with Futures Without Violence. And after that conversation, I realized that I was maybe not asking constructive questions, and that my background in trauma-informed practice had not prepared me to deal with this particular intersection. So I started to do a bunch of homework. Some of what I learned. Number one, educators are among the nation's most active reporters. So you already heard Liz say this as well, but about 1 in 5 reports are coming from the education sector. That was about 885,000 reports in 2022. I have yet to meet an educator as I do this work who already knows that. And that alone was a bit startling that educators have this huge footprint in the child welfare space, but are unaware of their own footprint. And one of the parallels, it's not a perfect parallel, but I think when you talk to educators about the school to prison pipeline or the footprint that educators have in this other public sector, a lot of them know, yes, that has to do with our suspensions and expulsions and the way that we do behavior management on the school side. But educators don't really understand what they do on the school side that has an impact on the child welfare side. And so I really wanted to start to raise awareness around that. But I also kept digging. And so you see a graph here that I created based on the two citations at the bottom of the screen. Catherine Crace in 2013 was looking at the number of reports coming from educators and the substantiation rate in 2013. And then the US Children's Bureau every year puts out a maltreatment report. And in 2024, they reported data out from 2022 and specifically shared some things around numbers of reports coming from different types of mandatory reporters and substantiation rates. And so you can see that educators have a growing footprint. That's the blue line. They've been reporting more and more over time as a proportion of all the reports in the country. And their substantiation rate has started to nosedive. So this is also concerning. It starts to imply that maybe the concerns that educators are identifying are not the right shape or size for this agency. As I continued to learn, I have come to the conclusion that reporting is at best an oblique intervention. Child maltreatment is real and it's very serious, and reporting seems to sort of sit over here. It doesn't actually have a clear and strong relationship to what we want to change or improve. So how did I learn that? Or how did I come to that conclusion? One, we have folks report after they're pretty sure that harm has already occurred. So as a public health professional, that means that we're maybe missing some early intervention and prevention opportunities. Two, in general, reports have a pretty low substantiation rate, but educators have the lowest substantiation rates of all mandatory reporter types, around 8 to 10%, depending on which study you look at. I went and tried to find out, like, well, what is it for cops? What is it for crime reports, right? People call in to police departments, for example, and say, hey, I think a crime is happening on my corner. And I thought, well, what is the verification rate for that? Just to sort of get a ballpark. The number that I could find, and I did not spend too much time digging, but the number I could find was a bit old. It's from 1980. But their estimate was that up to 83% of reports to police do get verified. And those authors thought that that was a considerable gap. So again, that like max 33% is for me startlingly low. And then three, the reporting doesn't have a clear relationship to either finding maltreatment or how much maltreatment actually happens. And I came to that from at least two different studies. There's one that looks at increased reporting in states where all adults are mandatory reporters. You might think that there would be improved child maltreatment outcomes or improved identification, and the authors did not find that link. Conversely, decreasing reporting is not linked to worse safety or maltreatment outcomes. And so again, like at best, it's sort of off to the side in terms of accomplishing what we want to accomplish. Furthermore, reporting is not neutral. It's not like, well, it's an intervention, maybe it's off to the side, but it doesn't really hurt anybody. The data doesn't actually bear that out either. Reporting interrupts relationships. And I'll get a little bit more into that with educators, but it also happens with other mandatory reporters. It deters families from seeking care. There was a study last year looking at folks in Wisconsin who had they were brand new parents, they had new babies, and they didn't even necessarily know they were reported, but the researchers were able to track families that did get reported and families that did not, both right before and right after birth. And the families that were reported had significantly less care-seeking behaviors in the immediate postpartum period. They didn't get their baby's care. Those new parents did not get care. That's really concerning. That's not the kind of outcome we want to be associated with reporting. Disproportionality in terms of race, class, and gender is baked into every single stage of Child Protective Services processes. So Black families, Indigenous families, folks with disability are much more likely to be reported, to be screened in, to be investigated, to have their cases substantiated, to experience family separation, and then to have their family separation prolonged, as well as to experience parental determination of parental rights. And for me, that points to a lot of subjectivity at the very best in sort of how we're going through this. And we're getting to family separation a lot. So for me, as a public health professional, one of the ways that I think about mandatory reporting is as a screening. Screenings also include things like mammograms, COVID swabs up your nose, those lists of like, well, if you have a cough and you have this and you have that, maybe you have RSV, right? These are all different ways of sort of screening for finding problems both at the individual level and at the population level. And as a screening, mandatory reporting also sort of fails me in terms of being something I can wholeheartedly recommend because it's not particularly accurate. It doesn't help us find exactly and only what we're looking for. A lot of the time, reporting helps us find poverty. It doesn't necessarily help us find maltreatment. It doesn't help us improve those health outcomes, as I was sharing on the last slide. The families and kiddos who get reported do not say overwhelmingly that it is acceptable or satisfactory for them as a process or as something that they go through. And again, it's not equitably distributed across all populations. So I took all of this and I said, my goodness, I have been working on any number of things in schools and around health, and I want to start to share some of this with educators and see what happens. So the first thing I did was put together the publication that you see on the screen. I worked on this with a cohort of educators from across the country, and I really wanted to bring the concept of mandated support, which comes to us from JMAC for Families, and is policy and programming sort of framework. I wanted to figure out how does that fit into education. Mandated support has a lot of different interpretations. I have broadly seen it unify folks who are interested in eliminating unnecessary or over-reporting, in elevating prevention over lagging intervention, in centering compassion and creativity, not just compliance or fear, and in prioritizing family support instead of family separation. So I wanted to figure out, well, that means a lot of things potentially. What does it mean in education? And we made 8 recommendations for individual educators to start thinking about this. This publication helped me meet a bunch of people. I started to meet social workers who had left the system. I started to meet attorneys. I started to meet doctors who were doing some of their own thinking about changing in the healthcare sector, sociologists, all kinds of people. And they sort of said like, whoa, this is so great. There's another person in the education sector talking about reporting and talking about the intersection with child welfare. Every time I meet somebody, I tend to get new links and resources to read. So then I kept doing my homework. I could not find exactly what I wanted. I could not find a data set that was just about educators as mandatory reporters. A lot of research on mandatory reporters dumps all the different types into one research bucket, or it's very limited to a sliver of the education workforce. So I could find, for example, a 2015 study on school psychologists in one district, and that didn't feel generalizable enough to me. Or I could find a 2016 study on principals and school counselors in a single state. And again, I was not sure if that was actually generalizable. So when I couldn't find what I was looking for, I made my own data set. With Kelly Fong at the University of California at Irvine, we came up with 56 different questions. We had someone who is experienced in survey design help us work on this. We pulled some questions from other people's research to see if things sort of overlapped, and we added our own questions. Hold on. We asked, this is more or less in order, we asked about how folks were trained and how they learned about reporting. We asked about what kinds of things they consider when they report, their actual reporting behaviors. What did they think was going to happen? When after a report happened, what did they actually observe happened? What kind of school did they work in? And what were their demographics? Almost all of these had set select answers, right? So when we asked people about training, was it this or this or this or this? This was a survey. This was not, these were not interviews. So there were, but there were a lot of open-ended sort of add-on, if you want to, opportunities. And we ended up with the largest data set of educators to date. This was a convenience sample. This was me distributing to listservs that I know, asking folks that I know through AFT national networks to help me get out. This was Kelly sending out through her networks. So it is not representative. We did not try to weight the answers that we got back. We did not pay a lot of money for this to be a representative sample. People seem to think that it's probably still legit, though, because it's a huge sample, because it covers coast to coast. We had California, we have folks, all the way on the other side, we have top to bottom, and we have a wide variety of education professionals. The title of the publication, Nobody Wins, is based on this quote from a teacher in Albuquerque who talked about reporting and not really seeing the benefits that they were looking for. At the end here, I've put in blue, it feels like a catch-22 where no one ever wins. I'm going to walk you all through 5 key findings. In December, I presented some of these key findings, so some of this will be familiar. After each key finding, I've also tried to embed some of your questions, and I want to speak to them directly as much as I can. Okay, so who did we hear from? Over 1,100 people. We had it open for almost 3 months. You can see here there's a heat map. There are a few places, especially the west of the country, where we didn't hear from anybody. We didn't get any responses from Guam, Puerto Rico, or Maine. We did get a ton of responses from New Mexico, New York, Maryland, and California. The other states were, sort of a range in between. We had a bunch of bots at one point hit the survey, so I did a bunch of cleaning to take those all out. Our respondents averaged 16 and a half years in education. Overwhelmingly, they were teachers. 61% were teachers, but 1 in 5 were specialized instructional support personnel. This is a federal term for people with a license who are not teachers and work in schools. That includes counselors, social workers, psychologists, librarians, speech language pathology, occupational and physical therapists, etc. I put them all in one category because there wasn't a broad representation from any one of those professions, and then a very small collection of classified staff. So this would be your bus drivers, your paraprofessionals, your front office personnel, your custodial personnel, those kinds of folks. And then other job titles that didn't neatly fit in any other category. So the first major finding, educators are not thrilled with mandatory reporting. Most of what they see after a report is absolutely nothing. That was the top answer. I didn't see a change. I reported because I had a real concern and I didn't see the concern addressed. The second most popular answer was it ruined at least one relationship. And the open-ended comments really talked about students stopped talking to respondents after they were reported, that students were removed from school, and families were relocated. Educators said, I don't necessarily have a lot of time during my day. Sometimes it's hard to pull all the information together, but that's not what bothers me. I can make do with that. Submitting it, figuring out how to get it onto the form or get it to the link is annoying or inconvenient, but I can manage. Waiting to see if this concern gets any better stresses me out. That really bothers me. I don't see it happening, and that's what I wanted. I wanted a positive change in this kid's life. We had 5 different things that folks might expect from Child Protective Services after a report, 5 or 6. And the 3 on the screen are the ones that the majority of the respondents said, yes, those were things I was expecting. I expected that Child Protective Services would monitor and oversee. I expected supportive guidance and information. I expected the family to get social services. For what it's worth, only about 17% of our sample expected family separation as an outcome of their report. So you all asked me, are education leaders on board with this? And who has the responsibility to make something else happen? So a few things. AFT does not represent administrators, principals, superintendents, assistant principals, deputy administrators, etc. Very few of them participated because they're not directly on our lists, and this implies that the folks who got the direct outreach did not share it with their administrators. I have talked with some administrators and with the AASA, which is the School Superintendents Organization. Anecdotally, I don't think I've had enough conversations to have a fully robust conclusion, but anecdotally, administrators prioritize liability and compliance. They are uncomfortable with thinking differently about reporting and child maltreatment interventions. That said, our survey did suggest that there's diversity among administrators. We asked about school culture, and I could link school culture to individual reporting behaviors. And the folks who said that they worked in school cultures where we report anytime we have this line of suspicion and we believe there's no harm in reporting have significantly different behavior, reporting behavior. It's much, much higher than folks who do not work in schools that where they affirmed that these things are true. Furthermore, there was multiple instances in the survey data of asking about absenteeism, and where folks said, yes, I am required to report absenteeism to a public agency. Those schools, educators who work in those schools also have significantly different behavior. Second key finding. Mandated support as an idea resonates with educators. Overwhelmingly, people said, of course, we want increased support for kids and families if they are facing child abuse and neglect. Furthermore, educators did observe bias. Most of their not most, 26.5. So about 1 in 4 comments in the open-ended section where we said, what kinds of groups or what types of families do you see being reported? Those open-ended comments were related to class status. So folks saying low income, poor, socioeconomic status, some phrase like that. And less than 1 in 10 mentioned race or ethnicity. In December, y'all asked me, if educators are seeing this bias, what helps them to sort of resolve that? Did we ask educators about their own bias? And how do we push past the basics and into some of the structural challenges? To answer these questions, I'm going to turn to some folks that I've worked with, that I've learned from. This is not from our survey because we did not ask about bias on our instrument. But Erin Sugru and Ashley Daftery are 2 school social workers, former school social workers, who are now in university positions. They recently paired up to do a survey just of school social workers related to reporting, and have also been doing a significant amount of interviews. Their publication is forthcoming, but I had the opportunity to meet with them several times in preparation for a panel that we were on together in January. So I have pulled directly from their slides to share these data with you. They found in their survey that 31% of school social workers had training that addressed bias, which means most school social workers do not. We didn't ask about it, but this strongly implies that most educators are not getting trained on bias when they're learning about mandatory reporting. When school social workers were asked about how bias impacted their reporting decisions, they said, it doesn't. I'm not biased. My bias doesn't come into play. When school social workers were asked about their colleagues, then people said, oh yeah, everybody else I work with is biased. This implies some cognitive dissonance, potentially. School social workers said, my colleagues have issues with class and race, but not me. It's definitely not mine. In order to address bias, so these school social workers, especially in interviews, were asked, like, do you try to intervene when you see bias at work? Do you try to change anything? They said sometimes no. They sort of struggled with articulating interventions, but the 3 top things that emerged in interviews that school social workers thought would work to address bias in educators were critical inquiry, asking hard questions about what might be happening, practicing consultation or team-based ethical decision-making to determine whether or not to make reports, and increased training. This is also something I shared in December. So one of the things we asked folks was, have you made a report in the last 12 months? And if they did, there was an open-ended space to share what elicited that report, or what were your concerns. So I went through over 500 open-ended comments, and I coded and coded and coded to get to a top 9. I stopped coding or stopped calling and reporting anything as a theme if a theme appeared in less than 5% of comments. But these are in order of the frequency with which they appeared. There were some instances in which 3 of these themes appeared in a single comment. So these percentages will not necessarily sum to 100. The most common thing that educators talked about was suspected physical abuse. That is the #1 thing that they said that they reported. They often talked about hitting, beating, and bruising as what they observed or what they heard about that led them to report. The second most common theme was hygiene issues. Folks talked a lot about clothing, that kids appeared dirty. and that they might smell weird. 1 in 10 talked about absence, missed days, late arrivals, not coming, etc. 9% mentioned sexuality, and I will explain what that meant in a moment. 8% talked about kids showing fear or showing reluctance, usually at pickup or drop off. Like this child appeared scared to go with an adult. This child appeared anxious about the person who dropped them off, for example. 7% mentioned health issues. This was health issues in a child, in a student, and or health issues in a parent. And mental was in many of those comments. 7% of educators mentioned an illicit substance or alcohol. Sometimes they were concerned about young people being users. More often, the comments were about exposure, that an adult in the child's life was using alcohol or was using an illicit substance. Food security and hunger issues were 5% of comments. And the child was alone or the child did not have supervision was the last most common theme. So in December, y'all asked me, what does sexuality mean? This was not sexual orientation. I reported a child for telling me that they were bisexual. This was not gender expression. I reported families whose kids were trans, right? This was not happening in the respondents' comments. Rather, educators were talking about children who had an unusual interest in, knowledge of, or behaviors related to sex. So some examples. Fourth graders who were mentioning blowjobs repeatedly at recess, and a fourth grade educator saying, that's odd. I know 9-year-olds. This is not typical. That concerned me. Or a second grade student who liked to follow her classmates into bathrooms to watch them undress and watch them use the bathroom. Again, that educator saying, that's not developmentally typical. I was uncomfortable with that. I wanted to report that concern. So another thing you asked me in December, since teachers know so much about young people, how do we leverage that? How do we take advantage of the fact that educators have these incredible observations? When I talk with educators about this, a lot of what they want to know is, what are the resources that I could turn to? If reporting that kid who follows other kids into the bathroom isn't going to get to the positive outcome, if it's oblique at best, then what actually works? Who in my community knows what to do in that situation? Because I don't. Should it be someone at my school? Is there some sort of group? Should their doctor know? Like who do I talk to about that kind of thing? And as much as possible, educators want prevention. They want programs. They want support. They are not interested in families being punished. They are not interested in family court being part of the solution most of the time. But how do we get to those if it's not through reporting? If Child Protective Services agencies or DCF in Massachusetts is not the pathway, then what are the pathways? How do I find those? I don't know where to go. I want to share with you some insights from Families Betrayed. This is just based on Massachusetts data, and I will do a very poor job of summarizing. Andrew King, who is part of this initiative, as well as folks from Boston University, Families Matters First in Massachusetts, worked together to put this together. I think it's going to be like 30 pages of a final report. I'm only giving you top lines on one slide, so all mistakes here are mine. But I do want to build on that list of top concerns. Number one, while educators do not identify racial disproportionality as part of how they see folks being reported, other folks in Massachusetts do find racial disproportionality and evidence of racism as contributing to overreporting. Families who were reported by educators, who are a significant part of this forthcoming report, talked a lot about their kids with disability and how schools maybe struggle to identify the roles and responsibilities in fulfilling an individual education plan, which is a tailored special ed program that's grounded in federal law for folks who maybe are not in education. When coming up with those plans, the spirit of the law is that families and schools come together and they say, these are the challenges that we observe, and this is how we want to support this student. And ideally, all parties agree on the interventions that need to move forward. Realistically, that doesn't always happen for a few different reasons. Schools have never received the full funding from the federal government to implement this law. And so it can be very expensive to implement these interventions. And that's really challenging for educators who have to balance a budget and who know who's actually on staff and their skill set. Furthermore, families and schools may have different ideas about the best way to address a disability or a learning need. When there is a significant tension, many families felt that they were retaliated against for not complying with or not going along with what the school wanted. They also talked about in Massachusetts, and I'm not sure if this is a pathway that's true in other places, but it is possible that kids with special education needs having an open case with DCF may make new money available to make sure that accommodations can be met. And if that is an accurate reflection of a state pathway, I think that's a rich vein for adding to the top 9 of potential concerns that really need our special attention. The last thing that I'll highlight from this forthcoming report is that when schools have a high turnover of leaders and inadequate staffing, so your speech language pathologist is in and out, your principal is in and out, your assistant principal is in and out, it can be really difficult to sustain thoughtful programming and to know all the partners that might be local and the best. And that might reduce service quality and again lead to families feeling like they have significant friction with schools. Third key finding, educators get training most of the time, and they think their training is okay. 1 in 5 educators did not get any training, but most of them get it. 73% said it's regular or it's recurring, right? It wasn't one and done. Most educators got training in the last 12 months, and it tends to be very local. So some folks have asked me like, well, who's doing this and who's standardizing it? It doesn't appear to be particularly standardized. That's not what our data points to. And in conversation with a lot of educators, this is what I find as well. The number one thing that educators get out of their training, I would say, is that they feel confident. Yes, I can identify signs of child abuse and neglect. You asked me about training, and I've got a lot of citations at the top here for how I've learned some of the things on the screen. You asked if teachers had ideas about other kinds of training that they might want. We did not ask this. And I think my biggest regret on the instrument is that we did not ask what they learned in training. We asked where they got training. We asked the last time they got training. We asked if they were satisfied with their training, but not what did you learn? If we get a lot of money to do a representative version of this instrument, that's the number one thing I want to fix. I want to ask again. But I did look at other people's research. That's a lot of what's cited at the top. Most training that's been evaluated in peer-reviewed literature talks about how to identify maltreatment, knowing that you are a mandatory reporter, and how to make a report. When I talk with educators about these sort of ahas and some of those early insights that I was talking about, that reporting is oblique, that it's not neutral. People say, well, I want to know more. Well, who should I be talking to about this? They want to know consultation. How can I be sure that I'm making the right call, right? Are there a set of questions, or is there a framework for how to make ethical decisions and get to, closer to the right answers and not noise in the data set? How can we be engaging families if that's going to be a critical part of the solution? What is local to me? And how do I do triage? How do we say, well, this is not a 5-alarm fire, but it's not something to ignore. So that's, I'm going to do this. And this is a little bit more hot, so we got to do a little bit more for this. And this is a 5-alarm fire. It doesn't need to be reported. How do I parse that out? How do I triage, or how do I use a tiered model of intervention? I have not found published scholarship on any training for educators or any other mandatory reporters that covers these themes, which is to say, 1, I suspect that these are mostly not things that are being covered in training, or 2, if they're being covered, they're not being covered at a scale that makes for easy peer-reviewed literature. Fourth key finding, educators are compliant. Not just with the law, but with their own conception of mandatory reporting. Most say, even if I wasn't required, I would have reported what I recently reported. So I think this is important for thinking about permissive or allowed reporting versus mandatory reporting. Most educators would be a permissive reporter. Even if you didn't require me to do it, I would have reported that most recent concern. What did they think about? They thought about ethics, they thought about evidence, and they thought about other educators. These are the top three answers when we said, how did you come to determine that this thing needed to be reported? None of those actually reached over 50% though. So I do think there's some room for introducing protocols and frameworks for decision making. And again, 2 out of 5 educators, or 40-ish%, work in a school that requires them to report chronic absence somewhere else. And again, there's a lot of compliance and different levels of reporting among folks who work in those schools. All right, you asked me about barriers. As educators are learning this, why don't they change? What if we know that this isn't working, which I'm not sure that a lot of educators actually do know, but if the system is broken, why don't we fix it? I think that there are a few things that drive the status quo. Number one is fear. Educators know the risk to themselves. I have yet to meet almost any educators who know what happens to families after they get reported, and that those include significant risks. Educators have told me that hearing directly from families and hearing what happens after a report for families who go through system engagement is transformational in motivating them to approach this work differently. So embedding those perspectives of families with lived experience is a huge part of what I'm trying to do at AFT. I also want to sort of underline something that I've learned from the Institute to Transform Child Protection, which is in Minnesota. Personal risk assessments, I will lose my license, I could lose my certification, I could lose my job, are not necessarily evidence-based. Those are often repeated in training settings, but in some places they don't happen at all. I have not seen any evidence of whether or not it's happening or the extent to which it does happen in Massachusetts. I know that in some places it doesn't seem to happen at all, like Minnesota. In Arizona, it's very rare. In other places, it's more common. And I think that's a good potential question for this initiative to take on. In addition, what makes it hard to change? The issues that educators are observing, including poverty, absenteeism, mental illness, disability, are real and serious. And because they're not easily one agency's thing to solve, I think this is where some of those like siloed solutions, this I went here and it wasn't the right door, but then I didn't know where else to go. And there isn't, it's no one's job to make sure that these agencies are collaborating every time around some of these challenges. I think that's one of the reasons that it can be hard to change some of these thorny issues. And then number three, as I've said, educators don't know actually a lot of what I'm saying, almost any of what I'm saying. They don't know that reporting is a relatively new intervention, that it popped up in the 50s and 60s. They don't know that there are other interventions, that there are other things we can do that are often more effective to address child maltreatment. They don't know that states have chosen to make them mandatory reporters. In the 70 years that the United States has had mandatory reporting, educators were not always on the list, and that is a state-by-state choice. And that states can enshrine protections for good faith non-reporting, just like they do for good faith reporting. I'm only aware of one state that has protections for good faith non-reporting. We're getting to the end of my main conclusions, and then I'm going to take a break so that hopefully you all can ask me some questions. Educators mostly don't report as individuals, and this was very surprising to me. In a given year, 80% of our sample said they observed between 0 and 5 students with signs of maltreatment. 10% of our sample estimated seeing more than 10 kids, and that 10% keeps coming up. In annual reporting, so what did you see? What did you report? 40% said I didn't make a report in the last year. 21.2% made one report, and 10% again reported more than 10 times. We also we asked folks, how many reports do you think you've made in your career? And separately, we asked them, how many years have you been in education? And that allowed me to come up with individual rates over the course of their career, or averages. 70% of our sample had reported ever. The middle 46.7% averages one report every 4 years. And this was the one that was particularly mind-blowing to me, because if educators have the first and second sort of spot in proportion of reports coming into to states, how can it be that most individuals are not reporting or reporting very stringently? Well, because the top 10% is reporting almost 50 times more than their peers. They average 12 reports in a year. So we wanted to look at who are those people? Are they different in some other way, or is it just their behaviors? They're significantly different in a lot of ways. If you read nothing else from the Nobody Wins report, I recommend this page, which I know is very small on your screen. We did two subgroup comparisons. So one, we called folks regular reporters if they submitted 0 to 2 reports in the past 12 months. And we compared them to avid reporters who had submitted 10 or more reports in the last 12 months. We also looked at, in another way, rare reporters. This was folks who said, I observed a kiddo, at least one kiddo with a sign of child abuse and neglect, but I made 0 reports in the last 12 months, which might mean they told a colleague or they did something else. For what it's worth, no one who said in the last 12 months, I made an observation, but I did not make a report, had 0 reports in their career. They were not never reporters. They were just rare. Compared to frequent callers, these were folks who said, I made more reports than observations of kiddos that I saw, which implies that maybe you made 3 calls about a single person, for example. So as we look at these separations, you can see along these lines between circle and circle, triangle and triangle, there were statistically significant differences on a wide variety of points. I have some of them on the screen. The folks who make a significantly more amount of reports or who are avid and frequent reporters have more training. They are much more confident. Their self-efficacy was significantly higher. They tended to say they had much more positive experiences with Child Protective Services. They had very different expectations. In particular, they were more than twice as likely to expect family separation after a report as their peers in the education sector. They tended to work in schools where compliance was elevated, where this was the first step. This was one of the first things they did when they observed a concern. And there's an overrepresentation in this bunch of school counselors and school social workers. However, the group was mostly not school counselors and school social workers. So we cannot say that it's like just those slivers within the workforce. You all asked me about social workers. And so here again, I'm going to pull from Erin Suguru and Ashley Daftery, who did the research on just school social workers. They find that school social workers average up to 9 reports in a year, and 70% of their survey sample estimated reporting frequencies that we would have called avid reporting. So 2 to 3 times a semester, 40% of school social workers, at least once a month, 15% of school social workers, and up to more than once per week, 14%. All right, I'm going to stop here and come back to this in a moment. I'm going to drink a little bit of tea, and I encourage you all to ask me some questions because I've been just like powering through these data. What do you wonder? What did I do too fast that I should go back to maybe? Otherwise, I will transition and share some like, okay, so what can we do? Thanks for this question, Marissa. The state that has good faith protections for good faith non-reporting is Washington. And I'll paraphrase the state legislation. So in an environment in which I am a mandatory reporter, and let's imagine that I've been working with a family for 6 months, and I'm making my observations, and I've gone through a decision process, and I've said these are legitimate problems, but I'm not making a report. And another person in the state makes a report about the same family. Now, if that is accepted, if it's screened in and it's investigated, the state has an opportunity to go through and sort of say, like, who might have missed this? And they might come back to me and say, Chelsea, what were you thinking? This person figured it out. Why didn't you? In that instance, where my judgment is being called into question as a mandatory reporter, Washington state has legislation that says that person, if they are a public employee, can call on their public employer to cover their legal fees as they go through the process of explaining why they decided in good faith not to report. And that their employer is on the hook for those legal fees. I have found several school districts where the school board passed resolutions affirming that they were going to spend the money to cover the legal fees for these people and make sure that they had due process protections in that undertaking. I don't know the outcomes of those, but I do know that the law is being used, is what I'm trying to say. Absolutely. Happy to answer that. I think it's a great example that could be potentially piloted in a single place, right? Like a union and a school district could come to an agreement to use that kind of language, or you could get it into the state legislation as Washington does. Kate, yes, I believe that Liz and the Children's Trust team will help make sure that this presentation is recorded and that slides are available. I tried to load you all up with references so that you know how I did my homework. I do not pull these conclusions out of my pocket. I'm trying to be really clear about how I've come to what I know. And thank you, Justin, for thanking me. Do we have early education? Not a lot. AFT members do include early childhood educators, and they are part of this data set. Again, we did not try to like oversample or weight samples. So I've not looked at whether we have enough to do a deep dive on just early childhood, but that would be really interesting. And AFT members do not usually include out of school time educators and staff because they're not usually in the education union, but a great point. I think you're right. And one of the things I'll talk about in a little bit starts to maybe get to some of the out of school educators. And Kate has things for us, so those will come in an email sometime soon. I see a hand from the Children's Trust offices.
Hi, Chelsea. It's Jen. Thank you so much for this great work. Question for you is, I think you said something a little bit earlier about schools that have protocols where the teacher has to go through to like a social worker or administrator to kind of work through that. Can you just talk a little bit more about that and what you found? I think it felt counterintuitive that I think what your data said was when those protocols are in place, you're seeing more filing happening. Did I get that right?
No, I don't have that answer.
Okay.
So one, on the survey, we did not ask about the existence of local protocols for making reporting decisions. And I think on a survey that could be difficult to ask about because it would require us to really define and give good examples of protocols. And the wide variety of protocols that I have seen would make that hard to collapse into a survey question. Two, I have seen a wide variety and I'm happy to share them. I don't have them in detail in this slide, but I'm aware of at least sort of 4 decision-making trees or models. I do have a slide on this. I've not seen anyone evaluate how well those models work. I don't know that they actually drive different decisions in terms of reporting or people adopting more effective child maltreatment interventions. So I do know they're being used. I know people are tinkering with them, but I don't know how much is working.
Thanks, Chelsea.
Absolutely. I'll pause here to see if there are any more questions before I jump into, otherwise that was a gorgeous segue into the next section. Okay, I do see another one. Lisa, I'm sorry that your internet has been in and out. There will be a video. The avid and frequent reporters, are there significant differences in their demographics, ages, etc.? Yes, absolutely. I did not have them all on screen, but in terms of their demography in particular, older educators are significantly more likely to report stringently. Newer educators with less experience in the profession are much more likely to be in the avid and frequent reporter categories. There were some differences by gender. Men were more likely to be avid and frequent reporters than women. I don't remember if we found racial differences. I don't believe we did. And I did look, we did have a question about sort of a sliding scale of political affiliation or political views. We asked folks about being, I think it was like relatively conservative or relatively liberal, and I did not find significant differences in political orientation. So that was one that frankly was a bit surprising to me. Alexis is asking about concerns for liability for bad faith reporting. Yes, absolutely. I think educators don't speak about this in quite those terms. There were several comments. I would have to go back and count them to give you like, was it 5%? Was it 7%? I don't know. I didn't count it. But there were enough to sort of resonate with me as a theme that educators said, I have seen my colleagues followed for this. I have seen the state come behind somebody for failure to report, and I get concerned, and I therefore default to reporting more than I think is necessary because I don't want to be followed. I also had folks say the family found out. They found out that I was the reporter, and they came and were, to say unthrilled would be an understatement. I mean, people described like violence at times, or they'd watched a colleague face that kind of retaliation. I think part of what you're saying, though, is bad faith reporting. Like, I know my neighbor is not maltreating her kids, but I'm going to report her anyway because I really don't like her and I don't like her dog and she doesn't talk to me. Blah, blah, blah. States know that this kind of bad faith reporting happens, that people leverage child maltreatment agencies as a retaliatory agency. Educators did not describe seeing their colleagues do that or admit to doing that kind of reporting themselves, where they were using the agency to punish the family. Or to retaliate against a family. I do want to underline that is a key finding in the report from Massachusetts researchers on Massachusetts families who have been reported by educators. They felt retaliated against for trying to talk about how they were really thinking around disability. Shannon, great question about school nurses. I tried really hard to get the National Association of School Nurses to help us get this out. It didn't happen, and we do not have a lot of school nurses in our data set. If we get money to get a really expensive sample, that's another, I wish we had better numbers so that we could pull them out and have a separate sample. But you got to have at least 30 to constitute a good sample, and we did not have that.
Well, I think I can help you with that because I'm on the board for the National Association of School Nurses. So I wish I had known this earlier or been involved in the conversations, but I would love to help support that in any way I can. I'm just struck by the fact that in all honesty, I actually had to pop out for a few minutes in the middle. I was in my car and I was actually delivering a vision screener to a school nurse, which I know has been come up in conversation related to, reporting those types of things. But I think when we're looking at national data, what's interesting to me about that is that we know in Massachusetts and in New England in general, we have a higher proportion of school nurses in schools. Almost every school has a school nurse, whereas any other part of the country, that is not the case. And the further west you go, the further south you go, right? There are less and less school nurses. And I mean, we know that nurses know what the social issues are. Nurses do extraordinary case management to try and get parents to care. And, there are multiple barriers. And I'm not saying every school nurse, and I'm not saying it's across the board, but where there is capacity, if I'm one nurse and I have 1,200 students, I don't have capacity to make, do the case management, the intense case management it takes to get families to the care and to, hopefully as a school nurse, I know my community resources, but we know in other parts of the country, I might cover an entire county, with thousands and thousands of students. There's no way I know every community and access and all that. And teachers don't either. Right. But I think that what strikes me is that this is always something that nurses think about is what are the social determinants of health and the barriers? And that's not language I think that a lot of teachers know and understand. And I think there's a lot of room for improvement between the work that school counselors do and school nurses do, where we're not siloed. Even in Massachusetts, where we're fairly well resourced, we certainly have gaps in lots of areas. We have silos amongst the school counselors and the school nurses. And again, not everywhere, this is generalizing, but where we see it work well is when we have those partnerships. When I was, for 12 years in my own health office, it was not one day that went by that I didn't talk to my school social worker. And we were constantly collaborating on these types of issues. So I think there's room there to build those systems and teams. And it starts with, I think, probably also the professional organizations, that support those professionals across the state. So anyway, that's my 2 cents. And I think we are definitely well positioned in Massachusetts because we do have certain resources. It's a matter of educating and helping everybody understand. I know that this is something on my radar. My role is the regional school nurse consultant here in the Northeast region. And so I support 50 cities and towns north of Boston, all the school nurses, every school, private, public, non-public, collaboratives. And this is something, and I know Karen Robitaille, obviously, as the director of school health, the Department of Public Health, is on the work group as well. So she, is doing has access to the nurses as well. So I'm hopeful, but I would love to see more school nurses involved and at the table when the decisions are being made, because when we're not at the table, we are forgotten about. And that's my plug. And I'm happy to help you with the National Association of School Nurses. So please connect with me or I'll connect with you.
Absolutely. Thank you, Shannon. And I'm excited that this is an initiative in Massachusetts that I think in many ways is trying to do exactly this, right? That one profession by itself is not going to deal carefully with poverty. I mean, no one's figured that out yet. So it's going to take, at the very least, some serious collaboration. So I want to get into what might work and what I know about what's happening across the country. And I've got another 30 minutes and a few cough drops, so bear with me. Okay. After I learned all of these things, I wanted to develop an agenda. How can we bring mandated support into education? So again, educators told me, we don't love this. They don't know all that happens on the child welfare side, but they do see on the school side, this is not working the way that I want it to. This is not accomplishing what I hope it can. And of course, I'd like more support. Those two findings alone were powerful for me to say, okay, it's time to sort of, continue to march forward. We can do more than awareness. We can get into advocacy and some activism. So how I developed the agenda by doing sort of two things. I went through a bunch of peer-reviewed literature. I tried to stick to the last 10 years because I think that's usually better than reaching back, 25. I wanted to look at child maltreatment interventions and what has the best effect size? What has the largest change? So there's almost nothing that I have seen that says if you do this, 100% of child maltreatment will drop, right? You're not going to find an effect size of 1. But when you get over a 0.4, when you get over 40%, like we're talking big scale stuff. So that's exciting. And many of the things that have been tried and implemented to address child maltreatment, frankly, have nothing to do with schools. And I have no interest. I was an educator. I work regularly with educators. I don't want to bring them stuff that says all of society is going to get squished into the school because I already know that's not going to be well received. So I wanted to find effect sizes and interventions that could resonate with educators because it's like something that's happening in schools, or it's already happening in schools and we can scale it, or it wasn't so far afield from how we already think about things that folks would say, Chelsea, you're crazy. So I'm going to walk through 5 things, and I'm going to be honest about those 5 things because while I do think that they have a powerful potential to scale, I also don't think we're necessarily there yet in some of the same reasons that Shannon was just outlining. The first is wraparound services. Wraparound services, when we talk to educators, for them, they're like, that is the whole child, that is the social determinants of health. They might not use those words, but it's kind of like if I focus on learning as a physics teacher, or I'm really good at teaching reading as someone who works with second language learners, I want a bunch of other people to come and think about the rest of the kiddo because I don't have the expertise in everything, right? And we also know that interventions that directly address poverty and material needs have some of the most dramatic effects on maltreatment. I watched a presentation by Claire, I wish I could remember her last name, at the Chapin Hall entity. And she said, listen, what we could find was up to 90% of child maltreatment can drop off if you just address material needs. That's phenomenal. It's not 100, but 90%, that's mind-blowing. So what does that look like in a school? First, I went back to What are the things that educators are observing that relate to poverty? So again, from that list of top 9, attendance is often related to poverty. Food security is often about poverty. Healthcare, hygiene, and supervision are about access to resources, about ability to leverage resources, about having or not having resources. They're not necessarily about I don't care. So, or outright neglect. How do schools already do some of this? They have mentorship programs. Those are phenomenal for changing attendance. Universal school meals can be phenomenal for addressing kids' food security and hunger concerns. Clothing closets and on-site laundry happen in some schools at a pretty low scale, but it's a quick way to get at hygiene challenges. Out of school time and programming can address challenges with when kids are supervised or when they don't have an adult in their life. The community schools model tries to push a lot of these things into a single building as a hub, and school Medicaid is sometimes a phenomenal way to fund a lot of this, especially school health programming. You all asked me about this. Again, where does this responsibility sort of sit with, and which community partners might do some of this work? Here's what I have learned. Just doing the programs that I just listed on the screen will not actually change the outcomes that this initiative has set itself to deal with. Changing the link between education and child welfare will not be a happy accident as a byproduct of having a clothes closet or as a byproduct of having a great school meals program. How do I know that? I've talked with one researcher who I cannot cite, so I'll just give some highbrow conclusions here. This person looked in a specific large urban center in the United States at community schools that have all those different programs sort of pushed in strategically from partners, and schools that were right nearby in the same neighborhoods, same demographics, and looked at what is the reporting rate in the schools with strategic resources and partnerships and incredible programs and the schools that don't have them. The schools with incredible partnerships had higher rates of reporting, more services, more amazing, juicy stuff, more reporting. This researcher really wanted to understand, why is that happening? How is that happening? This seems to fly in the face of dealing with material needs will drive down maltreatment, which in theory would drive down reporting. There's something happening here around more eyes on the family and higher rates of surveillance, or at least that was the hypothesis. This researcher was blocked from carrying out that next level of questioning and was not able to publish what was shared with me. Another pilot that is informing sort of how I got to this conclusion, we're not going to get to these outcomes on accident. We're going to have to do it really deliberately and say that this is what we want to accomplish. There's a pilot right now in Rochester, New York. They met with folks with lived experience, primarily reported by educators. And after a series of conversations, they said, what do you want to happen? They said, we want our mandatory reporters retrained, and we want liaisons in schools. So this organization started with the liaisons. They are putting liaisons from their own organization at 2 identified schools with very high reporting rates. We'll see. I don't know yet. I'm meeting about monthly with the woman who's coordinating this pilot. There's no data on it so far, so I don't know how it's going to work. I'll walk through a third example with a little bit more detail because it's a little bit older. The union and the school district in Rome, which is in upstate New York, shifted to the community school strategy now over a decade ago. They wanted to know what the basic needs were in their community. They wanted to make schools a hub where families could show up and get what they needed at a single spot. And they wanted their very rural community to expand how they thought about community and really, again, think of the school as a hub. The model was so successful that it has grown to 55 schools and 13 school districts. And it's no longer run by the district or the union. It's run by separate, dedicated nonprofits. It's been doing phenomenal work. They were so successful that the local Department of Children and Family Services, which is what it's called in New York, came to them and said, we're having a really hard time getting families to talk to us. We're trying to do prevention. We're trying to do support. And no one trusts us, but they trust you. Can you help us with this? And they said, sure. And they piloted the Resiliency Project. It took them about 2 years to get it off the ground. They share data, they share programming, and they put a liaison from the Department of Children and Family Services in 2 identified schools. They have served, in 2024, they served over 350 families, most of whom had several, you see here, 8,300 touches. So this is intensive case management for the participating families who are referred to the program. Some of their back of napkin calculations were that over half of them got support for SNAP and food security. Almost a third of them got Medicaid for improved healthcare access, and 1 in 5 had increased housing stability. They also think that educators are getting better at writing reports. In this community, it's common to literally write down your reports, and they often are seeing, I want to refer this family to the Resiliency Project. They're getting called out directly, so I don't want to report this as a neglect or maltreatment allegation. I want to refer them directly to this project. This is all being evaluated by a state university. I'm extremely excited to see what the official results are, but I don't have them yet. Second thing that could work in schools, health education that focuses on building young people's skills. This is one of the best researched interventions that directly applies to schools in reducing child maltreatment. They focus on teaching kids boundaries and consent, healthy relationships, and self-protection. I don't usually talk very much about these programs because they make child maltreatment kids' fault or kids' problem instead of adults' problem. And I think that's kind of gross. So it does work. These programs can be effective. It might be a solution, but it cannot be the whole kitchen sink. Family engagement. Home visiting projects have been shown to cut maltreatment, sometimes by up to half. The best models in home visiting focus on the strengths of the family, assume that everyone in the lives of the child, all the adults, are equal partners, and connect families to aid for specific challenges. So again, directly addressing some of that material need. However, I looked at home visiting projects that were specifically designed to address maltreatment. Those are almost always delivered by healthcare providers and focused on the immediate postpartum process. They do not include schools. They don't talk about schools. They have really next to no connection to schools. I also looked at home visiting projects that have been designed for educators to do with schools and with families that have students in school. The parallels in those models are what I am confident I want to say will work, but the exact link between home visiting by educators and child maltreatment outcomes, I've never seen any data on. I'm making an educated guess that it will work, but I don't actually know that. I also want to say the Parent-Teacher Home Visiting Project has some incredible 15 years almost track record of positive outcomes, and they recently evaluated themselves. They know that they have a racial and class bias problem. So I don't want to recommend them without qualification. Again, we will not accomplish what we're out to do by accident. Yes, educators can get more training. I think that educators need more training on a number of things that are not in their training right now. I can't find almost any evidence that there's consistent attention to bias, to these ethical frameworks that Jen was asking about. What kind of questions do we need to ask? And what is allowed versus what is required. You asked me about hard conversations. AFT does have a tool on this, but I want to walk through briefly where I know that new training or training efforts are underway. I have a meeting on my calendar, haven't had it yet, with Preventing Child Abuse Arizona, which created its own mandated support training that they focus on delivering to educators. It's voluntary. Educators, I think, would have to find their way to it, and I have no idea if they've evaluated it. 2, I know that California passed state legislation that requires a pilot in LA County. It is underway. It is not focused on schools. It's across the whole mandatory reporter workforce. It creates new training. It creates some awareness and knowledge-based tools. To the best of my understanding, schools and districts and other partners have to volunteer to take it. It is only in one county, and I have no idea if they have any evaluation data. I'm trying to figure out if I can get on their calendar. As you may have noticed, wildfires, ice raids, there's a lot happening in LA, and the The pilot has been a little bit of a start and stop endeavor. The working group on the workforce for Massachusetts got a presentation from the Office of the Child Advocate on new state training for the state. Again, they have trained, I think it was like 37,000 people. Almost all of them were educators. It is voluntary, and their evaluation data was on participant satisfaction. They did not have any data so far on reporting behaviors or educators adopting support interventions, but they were interested in potentially looking at it. New York passed legislation that required all mandatory reporters to be retrained by last year, April of last year. I have not seen consistent evaluative data that emerged from that requirement, but I have seen the way that the New York City Union, which trained over 150,000 people, how they evaluated. They mostly looked at, can you identify maltreatment? The educators across the state who have told me that they went through the training said it felt the same as what I've taken before. There's a little bit more on bias, but otherwise it felt pretty staid, and they don't expect that that will change behaviors. There is some data out of New York City that educational neglect reporting is significantly down. However, my opinion is that this reflects a policy change at intake. When folks call in and say, I think I want to report Chelsea for educational neglect, the hotline operators have policy, not just guideline, that requires them to ask the reporter, have you done something to try to address absenteeism? And if the answer is no, they do not take the report. I think that policy change probably influenced these data more than the training. AFT does some training around reporting. It includes some of sharing what I've said today, but we do not evaluate people's reporting behaviors or support interventions after the training. We do talk about family engagement. I'm almost done, y'all. Okay, policy change. I have 2 slides on policy change. These are big ideas. I think Massachusetts could make the attention to education and child welfare's connection someone's job. This is how changing the school to prison pipeline works, right? It had to be someone's job to pay attention to what their school district was doing with suspensions and expulsions, and then reporting it and making it public. Who is going to track that? Who is going to say, this disproportionality makes us uncomfortable, we have a plan, we're going to improve it? Some states have family Miranda. This is telling families you have rights when you engage with the child welfare system. This could be clearly communicated in student family handbooks. I have seen an example in San Francisco, not because it is required, but because it's what they want to do. Schools could, a policy could be to explicitly uphold due process, both for families during active CPS investigations, and this would potentially be very similar to the ways that schools uphold due process for ICE investigations. They could also do uphold due process for educators, as I've already outlined, is happening in Washington. Other ways that we might change the way that reporters think about risk to themselves and potentially shift the way that they think about risk to kids and families would be to remove punishments for failure to report, or to codify a duty to intervene, which is not the same as a duty to report. Do something. Something does not always mean reporting. And training them on what interventions could include, or triaging through multi-tiered interventions, is one way to potentially prepare folks to intervene with such a duty. Lastly, the state could take on new definitions. Who is a mandatory reporter is a state-by-state decision. Educators do not have to be on the Massachusetts list. They would still be allowed to report. The infrastructure for reporting would still exist. But if educators are sending so much noise to the data set, and it's so rarely helpful to the agency, and it's harming kids and families, I would argue this is not an intervention that needs to be required. Lastly, slowly, I am working on a report. It will go through peer review, which will take even longer, on educational neglect. What I can say right now is that states that use the concept of educational neglect, or that use Child Protective Services to enforce attendance and compulsory attendance, have doubled the reports from the education workforce compared to states that do not use this concept. Massachusetts uses it. You don't have to. If you go to this bit link, you can find a bunch of stuff that AFT has created to try to deal with some of the gaps that we see. I won't dwell on it here. I saw a few things pop into the chat, but I couldn't read them. So I'm going to come off of screen share and hopefully end with a few more questions. Okay, Lisa left. Sorry, Lisa. Good to see you. Rachel also left. Okay, amazing. Shannon is from Rochester. The organization is called Hope 585. And I think I'm meeting with my peer from that organization like Monday or something. So a new update is coming. We'll see.
Yeah, it's interesting because obviously Rochester and Rome are two very different communities, right? Rome more rural, Rochester obviously is pretty inner city. So that's just interesting. I would really love, thank you for all of your work, Chelsea, in presenting today. I would love to see some more Massachusetts specific data. And I would love to see more collaboration as far as you're talking about recommendations, explicitly building these relationships between what I will call the school health teams to include school nurses, school counselors, adjustment counselors, and, building the supports for those teams to be able to collaborate more explicitly together around this issue, because I know you teased out a little one study that talked about school counselors, but again, we know that national data does not necessarily represent Massachusetts data. And I think that's really important when we're trying to build a system in Massachusetts, that we're looking at what's happening in Massachusetts. And maybe it's, kind of a mirror of the research you're already doing with a little bit of those, things you'd also like to add into your research, the questions that you talked about today. So I think that could be an opportunity. I find that sometimes as a school nurse, and when I'm looking at some of the national data and best practices related to school nursing, there's often this gap because we do have more resources for our nurses here in Massachusetts, and therefore, sometimes, not always, but sometimes are doing all of the things that, are being recommended. So just a point for finding some more Massachusetts specific teams, and we're doing it right now, right? So that's good news, but explicitly bringing those partners together intentionally. And maybe this is DESE along with DPH, maybe this is the professional organizations, the Massachusetts School Council Organization, Massachusetts School Nurse Organization, which I also sit on the board of. So I think there's plenty of opportunity. It's just, as always, time and, time to do the work. So thank you again for your presentation.
Absolutely. I will say, I don't have perfect research. I've tried to be transparent about where I have really clear answers and citations, and where I'm making some leaps and some jumps after having done my homework and tried to find specific things. But my take today is that Massachusetts is highly unlikely to be special on almost any of the trends that I shared.
Yeah, I would agree with that. But as far as the solutions, I guess is more what I'm thinking about. Like what are the I'd love to see some examples of policies, sharing policies, those types of things, because the things that are different about Massachusetts that are, there's a lot of, including New York State and a lot of the other states, work more by county. And so their school systems are larger. They're, just the structures are different. And I know that sometimes we struggle in Massachusetts because we are local control, right? And that can sometimes get in the way because, so there are, I'm sure, examples of that from other states that are more broad across the state, because they do have these systems that work by county and by state, as opposed to like we do in Massachusetts, 351 different communities, different policies for everything, right? So for sure, I'm not saying we're special in that the problems that we have. I guess I'm thinking I'd like to see also like what people are doing that's working in Massachusetts, because yeah.
That's fair. I know that the Department of Children and Families has committed to sharing some data on one school district, and I'm excited to see it when it's available, to see what can be known. And it was selected because it's a school district that uses that strategic partnership model in select schools. And so that will allow us to sort of try to make some conclusions about whether that strategic partnership model, like I mentioned in the urban center, that was not published, if those schools have different outcomes or not, and what we might learn from that. Sarah, I see your question in the chat. a couple of slides back on the parent-teacher connection, our school visits or parent-teacher home visits for school age or also birth to 5. I did not include any research on the birth to 5 home visiting model because the audience that I usually talk to does not include a birth to 5 set of students and families. I think there's good research on the child welfare side about how those home visits drive down child maltreatment. Part of what I wanted to underline is that the home visiting model for maltreatment is not identical to the home visiting model for school-age children. And so while I suspect that they will have similar outcomes, it's a suspicion. It hasn't actually been shown or officially evaluated whether parent-teacher home visiting projects for school-age children change reporting behaviors or the adoption of more effective maltreatment interventions.
All right.
Chelsea,
Any other questions? Oh.
so I just want, Liz, I'll pass it to you in just a second. I wanted to thank you. So Priscilla and I came in a little bit late. So I'm Jen Valenzuela from Children's Trust Executive Director, and Priscilla is our brand new Director of Community Initiatives, which those of you who are getting involved in this work or going to be from the periphery will get to know Priscilla more and more. And I'm so grateful for you, Chelsea. And boy, what a gem. I've been giving Priscilla insights of like, she's amazing and the work that you've been doing. And so we're so fortunate to have you part of this steering committee with us in Massachusetts. If I know I came in a little bit late, we came in a little bit late. We were doing a working meeting with lived experience folks with lived expertise and making sure that that's getting more integrated in this full initiative. And so needed to work with that group first. But I just want to say like, this is just the beginning. And so excited to have the data that you're presenting to us. And Shannon, like the questions you were asking, I think, you know, one of the things the leadership steering committee has been asking is this enough? Can we be satisfied with this data and get enough knowledge from that to say we don't need to spend more time on doing more research to justify potentially get some of the same answers or not. And so a lot of this initiative is about, we have a lot of data out there already and we want to be able to use that and get to action sooner. And also Priscilla and I were talking and I was like, okay, if we were to do more, not that it would stop us from moving forward with action, but some questions that we would want to be thinking about for future. So appreciate all of the thoughts and comments and so much more to come. So it's really thrilling to see folks on here. Liz, I'm going to pass it to you to wrap up, but Chelsea just really wanted to thank you for being a part of this and bringing all of your knowledge. It's been great. And did you mention the New York Times articles? Did anybody plug those so people can see them in your report?
No.
Okay.
So I think it's been about a week. The
Yes.
New York Times did a short article and then a paired companion piece looking specifically at educational neglect. They frame it as a debate between folks who say that educational neglect or repeated absence does not need to be reported to Child Protective Services, and some other folks who say, yes, it should. But as part of looking at that supposed debate, they cited Nobody Wins, the report that I just walked through, as one of the key resources that you might look at to start to get a handle on this space.
I'm going to drop the links in there. Oh, there they are. Oh no, that's the next one. But let me see if I can get the New York Times links in there for people too, because they're good articles. So your work should be seen.
We can send those out with the presentation and the slides as well.
Perfect.
As well as the link to the full report.
I'm done jabbering.
Well, thank you all for joining us today. As a reminder, today's presentation is part of an ongoing series where we'll continue to dive deeper into various data sets regarding child neglect reporting. So our next session, I dropped a link in the chat, is Wednesday, March 25th from 1 to 2:30, and we'll focus on qualitative and quantitative data from a parent survey conducted in the mental health advocacy program for kids. So if you're able to, please join us for that, the next in the series, and we'll also get the materials out to folks. And if you continue to have questions, please feel free to send them over, and we'll keep them on file to be addressed. So thank you all, and thank you, Chelsea. This was fantastic. Have a great afternoon.
Can I put in one last plug before we go, just because we have 2 more minutes? AFT does a virtual conference every March with all kinds of professional learning activities. If you're an educator, maybe you want to check out the whole series. I just put in the link to register for a webinar with Maisha Parker, who is part of this initiative in Massachusetts. She is a parent with lived experience. She knows exactly who reported her. The reporter worked at a school, and Maisha is going to talk about how educators bring power to these interactions as mandatory reporters, and how to leverage that power for well-being as opposed to harm. I'm really excited that we get to share the voices of families with lived experience directly with educators, and I'd love for you to join us. I'd also love for you to share it if you work with educators or have folks that you think might benefit from 55 minutes of hearing from a parent with that experience. Thank you for this time and for you all's deep engagement. I really appreciate it. And I appreciate the opportunity to talk more in depth than our little corner in December let me share. So thanks for letting me nerd out, y'all. Have a great day.
Thank you, Chelsea.
Chelsea, we'll make sure we get the info out for that webinar. Okay. And I'm so excited. This is Maisha from Massachusetts, right?